Hi there, my name is Glenn Withers and I'm one of the founders here at APPI Physiotherapy and Pilates Clinics. Now my role is as the clinical lead physiotherapist for us here at the Hampstead Centre, and myself and my colleagues and the team across at Wimbledon, we're doing a series of educational tutorials to try and help you understand some of the more common things that we see in the clinic day in, day out. Now, as one of the leading physio clinics here in London, we see an enormous amount of people through our clinics across a week, let alone a year. And with over 20 clinicians across the two sites, we've always got people here to be able to help you. And one of the most common things that we see is anterior knee pain. So you may think it's very odd that I'm here with one trouser leg up like this and the other, but it's to just talk to you in a moment about anterior knee pain. Now, anterior being front of the knee, knee pain, that's that pain that comes sort of around the front of the knee, sometimes around the kneecap. It can be a little bit more on one side than the other, or it might be through the middle. Now, anterior knee pain can be derived by a number of different sources, but more than anything, most of the time, it's because of a biomechanical issue within the way that you move. So for example, if I stand up here, when I bend my knee, I should be able to keep my hip, my knee, and my foot in the same line like so. But a lot of us, as we run, as we walk, as we play sport, as we land, we come inside a little bit, and that puts a lot of strain onto the knee joint itself. Now, that might be because of an issue in your hip and your hip alignment. It might be been that way since you were very young. Often it's because there's a little bit of a pronation problem in the foot, in that your arch is dropping down, and as the arch drops down, the whole upper thigh rotates here, and that causes this sort of biomechanical distortion when you're doing any forms of activity, be it running, walking, whatever. We see this often in our younger people, in our sort of 12, 13, 14-year-olds. We see a lot of this patellofemoral pain, and a lot of the times it's just pure biomechanical issues. Now, the good thing about that is we see this every day. We've seen it day in, day out. We've been here for 2 decades treating these sort of issues, so we know exactly what to do. And most of the time it is purely biomechanical. We give you a series of exercises to rebalance the load that's happening through the leg, and we may or may not look at some orthotics into the foot and to just try and help out the mechanics. But most of the time, anterior knee pain is not a big deal at all, and it's something we can really help with. And a good part of this is most of the time, it's not necessarily what we're doing in here, but the exercises that you can do at home. So what are we looking at within the exercises? Well, when you have pain in your knee, what happens first of all is the vastus medialis oblique, the VMO, it sits on the inside of your knee here, that becomes weak or inhibited because of the pain. And then the ITB that you're probably familiar with, that's a long strip running down the outside of your leg. That takes over, trying to control what's happening between the knee that's a little bit more unstable or weakened and the hip. And so that ITB tightens up. That can then pull the kneecap across, and you have this biomechanical malalignment issue. So how do we manage anterior knee pain? Well, in a way, it's actually pretty straightforward. Let me give you a trade secret here. It's pretty straightforward. We need to get the glutes working better in line with this VMO. Okay, so if I can get the glutes up here, the VMO in here working correctly, I'll realign the femur, the upper thigh bone, and allow my mechanics to be a lot more correct or streamlined in the way that I move. So how do we do it differently? Well, one of the things that I've seen over being a physio for many years, involved in elite sports and all different types of sports, and working in our clinics on a day-to-day basis, is that a lot of people just start the exercises at too high a level, like that single leg movement that I was just doing. Great exercise, but if you have had pain, well, the underlying mechanics of the knee need to be corrected first, and then we can start to build up. So let me share you a little tip here. It's really easy to get started. Basically, we need to fire up the quadriceps as a whole, specifically this inner knee muscle, the VMO. Then we need to get the VMO and the glutes working together, and then we need to get the glutes much stronger. So here's how we manage anterior knee pain here at APPI Clinic. So we're going to give you a series of exercises, and they really are pretty straightforward. So the first thing that we have to do is wake up these muscles, and we can do that with an exercise called your static quads. So we get a towel and we just roll the towel up. We're going to place that towel underneath the painful knee. And first of all we're going to do is push down into the towel and look to get activation or increased tone into that muscle, okay? So we're going to exhale, press down, working quite hard. We hold for a count of 5, 4, 3, 2, 1, and release, okay? But again, common exercise, but one of the things that happens is often people don't do enough of it. Because it's a lower level exercise, we shouldn't be having any pain issues here, so we can do more to get the response. So rather than giving clients 10 exercises, which you see sometimes people being given, we're going to give you 30, 40 of these to really fire that muscle up and get it working appropriately. All right, now we need to try and be a bit more specific. We fire the muscle up. Now we need to get into that inner knee muscle a little bit more. And so now what we're going to do is from that position, we're going to lay back down. You can even lay all the way down. Turn the foot out. So from here, we're going to turn the foot out this way. So we're in a bit of turn out, almost like that top knee muscle there is now facing the ceiling. Okay? Now from here, we're going to tighten the leg and now lift the whole straight leg up, hold, and then slowly bring it back down. So count of 4 or so, and then bend. So tighten, activate, knee lift up, and then a 4, 3, 2, 1, back down. To again, really fire up that inside knee muscle, that VMO that we need to get working. All right, now, you're gonna do sort of 20 of those reps, depending on your fatigability, and that's what we'll work with you in clinic. But you're going to do about 20 of those and really get it working at a much more sort of build-up sort of function, so we can get the results quicker, basically. Okay, so that's all about the knee. Now we need to get the knee and the hip talking together, and this can be quite challenging, but a very, very straightforward exercise that over the many years of being a clinician I've learned is one of the most effective is a simple wall push exercise, okay? So what we're going to do here is we literally lie down on your back and you're going to put your feet up against the wall, okay? And now from here, all you're going to do is press into the wall as hard as you can. So you press hard. The wall's providing resistance. You'll feel your leg muscles working, you'll feel your glute muscles working, you even feel your core working a little bit as well. So you press, 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 count of 5 again, and release. And then press, 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 count of 5, and release. Okay? So very straightforward, but a very, very effective exercise that is often overlooked. So we've got our static quads, we've got our straight leg raise and external rotation, and we've got our wall push as well. Now these are all predominantly very sort of inner knee muscle activation. So a lot of people when you have back pain talk about sort of core in your back. Well, that applies to the rest of your body as well. So we're effectively trying to work that sort of core of the knee, if you like. And then we need to get the glutes firing. And to get the glutes and the knee working together, a very familiar exercise of the shoulder bridge and hip lift is the best thing for us to get going. So again, it's an exercise where we have you lying down on your back. Okay, now I'm just going to grab this little ball here because this can really help with this exercise. So here we're going to put the ball between the knees. That allows the adductors, the inner thighs to work. The adductors connect to that VMO to help it all work together. And then from here we get our core engaged, and then we come through our shoulder bridge where we will roll the hips up, squeezing the glutes, holding that ball in place, and then we can roll back down. But we do 2 variations here. So we do your articulated bridge, like so, which is really nice to get the back moving, to get the sort of glute max, the bigger glutes working for you. But we need to get the inside hips working as well. And so we do 10 to 15 articulated bridge, and then 10 to 15 straight spine bridge. So that's like a hip lift. A straight lift and lower. Lift and lower. So now I'm not getting that articulation, I'm not using the roll through there at all. Alright, so 4 key exercises, pretty straightforward to do. Static quads, straight leg raise and external rotation, wall push, and your bridge, both articulated and straight spine. Now there's much more besides that can help. We can get working on that ITB, release the adductor a bit, work into piriformis in the hip, which is probably overacting, work on your mechanics, and then bring you into our rehab studio and get you strengthening, doing our strength and conditioning work, exercise bike, video analysis on the running machines, lots of other services that we can help you out with. But hopefully that's given you a little bit of an insight into anterior knee pain and how we can help you, but almost more importantly, how you can help you. I hope you've enjoyed the tutorial, and I will see you guys again very soon. Bye for now.